If quality improvement is the use of methods and tools to try to continuously improve quality of care and outcomes for patients, how can we determine what that true value to a patient is without involving our patients? As patient partners, we believe that quality improvement is best quality when there is patient partnership. Over the last 7 years, working together with staff, I've been involved in a lot of processes and initiatives that bring improvement of experience to patients. But I'm going to talk about 3, which stand out for me with impact on the patients we serve. The first is our Patient Partnership Council's first priority back in 2017. Hello, my name is. A greeting with a smile. A first impression, the start of a relationship and the beginning of a partnership. Tell me who you are, what your role is, and what you're aiming to do. Involve me. First 15 steps where we can make it or break it. And how do I know that this improves patient experience? By initially asking patients through our formal PPC review process, but no review beats seeing, as I have time and time again, the impact it has on our patients whose anxiety can lighten within seconds of this greeting. An always event, in my opinion, a lost opportunity when we don't, and don't just say it. Wear it on your name badge, and please don't rely just on your lanyard for communicating this, where it is generally swung wrong way round, normally at groin level, a bit awkward and you're trying to read it at that level, but clearly on a badge identifying you and your role. Please wear your nurse in charge armbands when able to, and how I would love to see names on the theatre caps too. And this isn't fluffy stuff, because what I've learned is how much impact it has on patients and families. The hugely important personal touch, yes, but as the one constant factor in our healthcare, it helps us play a role when seeing many different health practitioners, and we are able to refer to staff by name and role to help continuity of communication and care, which can, as we know, be a significant challenge. I've also learned that this helps staff too. We are a vast organisation. Greeting our staff and being clearly identifiable is not only welcoming and helpful, but it can also increase safety as another catch point in the Swiss cheese model of multiple layers. And this I powerfully learned through cases in our patient safety summits, which leads me perfectly onto these, which was a groundbreaking first in 2015 in getting staff of all role and rank to sit together and reflect in a safe space on where things went wrong, could have gone better, and to learn together as an organisation from them. This alone, and then 10 weeks in to introduce me into the process, asked for my opinion on by the medical director, and some of my thoughts actioned on by the very next summit, bravely opening the doors to the inner sanctums of healthcare for the very first time, and was the catalyst in 2015 for, in my opinion, the patient partnership movement that followed within our trust and was heralded by many other organisations around the NHS as we pioneered the concept. I did wonder how staff would react to me, a patient at the very heart of learning where things go wrong. How would staff feel sharing and discussing error and harm with me in the room? What could I contribute? Patients hope when they come into hospital that they will be fixed, but they certainly expect to be safe in our care. And I have learned that despite the best of efforts, that this doesn't always happen, which is why I have championed patient safety summits so relentlessly. I'll never forget my first meeting, going into a crowded room with my heart pounding so fast from fear I was sure people must have heard. But what really helped was my very proactive approach at the start of all those early meetings in introducing myself and building confidence and trust by saying that I was here to contribute, work and learn together. This was us together. And in fact, this approach has served me very well in all my patient partnership work. This is not you and us, but we together, and we are stronger for that. I do believe that having a patient in the room has supported the safety culture. When I started going to the meetings, I noticed that the questions were rather hierarchical, with closed questions coming from more senior doctors and nurses. This changed quite quickly, and I am certain seeing me ask questions and discuss answers empowered others to do the same. In fact, people told me that this was the case. I recall being told that I asked the questions they wanted to ask, and me asking helped them ask too. In addition, I have always asked how the patient or their family could have been involved more in their healthcare. I'll never forget, though, hearing back in those early days from a meeting I could not attend, a doctor saying, "What would Sarah have asked here?" A key moment in partnership had been reached. And to this very day,
Sarah, you're on mute, I'm sorry.
oh gosh.
Yeah.
And to this very day, I still see how hard it can be to question another on safety. But we have to do this. And I believe that patient safety summits with a patient partner involvement continue having a key part to play in improving that culture of doing so and bringing greater safety for patients and staff, for all. And to our very precious cancer support films. From an initial idea I had 6 years ago, working with Mairead, another cancer patient, our Macmillan support manager, Alex, Nigel, Rachel and Charlotte from our medical photography department, Jodie and Nikki from cancer outpatients, and a supporting cast of patients and staff, we made a cancer support film, Getting to Know Us, with the accompanying candid conversation, a film by patients, for patients, to help allay new patients' fears of the unknown by taking the viewer, led by myself and Mairead, through oncology, introducing staff, showing some processes and covering the simplest of such important things like car parking and toilets. Mairead and I decided what we'd like covered and agreed our dialogue, and working together over a period of months being fitted in around our staff partners' medical commitments, our film came to life. We premiered in September 2017. It has been viewed nearly 6,000 times. We then went on to produce our second film, Getting to Know Chemotherapy, using exactly the same format, which at one point through the pandemic, we thought would never see the light of day. But with some editing to reflect our new challenges, it was released in December 2020, now having been viewed nearly 1,500 times. Response from patients and health partners has been wonderfully positive, but never more so than now throughout this pandemic, when unable to bring friends and relatives in, being able to see our films and share with loved ones has brought real comfort to many. And it has been an utter joy to hear that we, the team, have made such a difference. None of this would have been possible without a shared vision and belief in partnership working that in the early days saw our trust powerfully take on other NHS organisations to insist on patient partner involvement, as that was what we believed in. When we do partnership well, as I hope I've demonstrated here right from the outset, we do it very, very well indeed. And we can see the benefits it brings, giving greater surety to answering that key question of what is true value to a patient. So my plea today is to please, please keep making it true partnership. Please think patient partnership in all that you do and invite and welcome my colleagues to your table of improvement. not as an afterthought, a tick box exercise, or being asked for opinions on something that is already a done deal, but from the start. In my role as a patient partner, the most valuable aspect has been out on the Gemba, seeing, hearing, feeling what patients and staff are experiencing, speaking to people and feeding it into conversations and learning. Nothing more powerful than seeing and hearing, capturing golden nuggets of excellence, but also areas for improvement. I cannot recommend it more highly. Having been involved at the very start of the Virginia Mason collaboration back in 2016, another patient partner first for our trust, being the only one of the trust to have patient partner involvement from the very beginning, and part of a number of RPIW weeks, as many other of my patient partner colleagues have also been, it is terrific to see now in 2021 how the Pride Way continues to develop, and see how the strategies we learned are being used to bring such continuing improvement all around the trust, making such a difference to our patients' experience. I am but one patient partner today, speaking about my experiences, but I'm proudly representing my dedicated, fantastic patient partner colleagues and all they do too. What an honour to be able to celebrate patient partnership as a continuous improvement today. It really is in all your hands that it continues to be such. Thank you.